Hello, my name is Tammy Flick, and I work for Telegen, which is the Regional Extension Center for Iowa. Today I'm going to be covering CPOE best practices and recommendations. The objectives for today's presentation include planning for CPOE modules, implementation of the CPOE module, and optimization of CPOE use. Don't worry, I have a plan. The problem with paper is that handwriting can be very poor, and deciphering hieroglyphics, or as I like to say, reading some chicken scratches or other ways to phrase that. But I worked as a nurse in the ICU on night shift, and I personally have had to decipher those hieroglyphics that providers have written and try to understand those orders. There's also risk of incomplete or inappropriate orders, orders on the wrong patient, the lack of drug formulary, and drug allergy checks prior to the order being written, delays in workflows, and also the delays by clarifying orders. Many times you're unable to electronically complete that drug allergy, drug disease interaction checks with a paper-based order. So with the electronic orders in CPOE, you're able to do that. There's also ways to streamline care using CPOE and remove the unnecessary variations in care that can happen with written orders. There's also inappropriate medication selection, dosing, or frequency of medication administration that can happen on paper-based orders because there's not the checks and balances that happen with electronic ordering. Also, there's a difficulty in adhering to drug formularies that are available in pharmacies in the facilities that use CPOE. So with a written order, a provider may order a medication that isn't on the formulary, and then there's a lot of rework that has to happen in order to find a therapeutic substitution for that order. Approximately 7,000 Americans die annually due to preventable medication errors. 1.5 million people are injured, and 1.5 to 4% of prescriptions are in error with serious health risks. 5 to 18% of ambulatory patients experience adverse drug events, and the cost of these errors is estimated to exceed $2 billion a year. In order for patient safety to be at its finest, it's more important to use CPOE to be able to have those checks and balances in place prior to the order being placed. How do you plan for CPOE? Put me in, coach. Not many would say that when they are chosen to be the lead on a CPOE project. It's more like the old Life cereal commercial, let's get Mikey to do it. You need a champion or two. Having a physician champion is key to make this work. They need to be respected by their peers and to be looked to as a leader. It is also very important to have a nurse champion, and sometimes those can be silent leaders. We had a staff nurse that everyone respected and looked to for guidance whenever change took place. And she didn't say much, but when she did say something, all the other staff would listen. So it's important to look for those key players as you go into the implementation process. You can also engage staff that is techie, but may not be in a role of a nurse or provider, such as a patient care tech or a lab tech, or somebody that just really is interested in electronic medical records and CPOE. Planning is imperative to make a successful implementation of CPOE. You can engage your providers and end users in the development process and approach the team and involve all the stakeholders. This is to ensure all that are involved in the process are able to communicate and develop the processes in a way that is conducive for all involved to do their job quickly and safely. In other words, we support what we create. So when folks are involved in building and planning processes, they have a vested interest in seeing it succeed because it reflects on them since they have been involved in the process. Developing a project plan is very important when you're in the planning processes of implementation. You can create a timeline with the deliverables and due dates, action items, and who's responsible, and also planning those project goals and tasks. In order to keep the implementation on track, a project plan is a great tool to ensure that there is no delays or forgotten tasks that could potentially affect the project. This also gives clear expectations and deliverables to the staff involved and a method of tracking the project. It is important to assign a project manager in this implementation. It can be any key staff on the project, such as a pharmacist or nurse leader. Setting the goals in the beginning is key to be able to track your success and show that you have made this a successful implementation, or show areas that could have been improved within the project for future reference or to help to improve the processes as you move forward in the project. Assigning tasks and due dates helps keep all involved on track and also makes it easier to address anyone who is not meeting the deadlines for their tasks. No one wants to be the bad guy, so this document actually gives you a way to follow up with people and make sure that they're keeping on track without looking like the bad guy. Also, there is another version that's available that you could use, and it's called a WIP document, or a work in progress document. And this is actually a very easy tool to use, and in the smaller facilities, in clinics and hospitals, Microsoft Word is often available. So I'm going to show you a sample here of what it may look like. What you do is you put the date assigned, who it was assigned to, what the task was, what the due date is, and any comments or updates, and then the priority, whether it be high, medium, or low. Once a task is completed, it falls to the bottom and is shaded in a different color than the other tasks. So if you look at the very top, I was assigned to create this WIP document, and then the update is that it started in 50% complete and it's a high priority. So every meeting that you hold with your project team, you can update this WIP document and then share it after the meeting, and then be able to assign tasks and track them appropriately without having to invest in any project management software. So as we go back into the issue of creating goals for the project, a key way to create those goals is to make them SMART, which means they are specific, measurable, attainable, relevant, and timely. So a sample there is, by June 1st, 2013, 80% of all medication orders will be entered via CPOE. You can even get more specific by saying on the med-surg unit or within the whole organization, whatever you set forth as your goals. It's a simple way to make sure that your goals that you set in your project plan can be tracked. You could also use visual representation of tracking goals, and it can be very motivating, such as using pie charts or graphs to show where you're at with your 80% goal. You can also create a fun chart that can be posted for all staff to see in a staff accessible area, such as a horse race where you have all the different providers lined up on this track, and it shows who's winning as far as getting the most number of orders in. You have to look at your organization individually and decide if you want to go to the more classic, just pie charts and graphs, or if you want to use something more fun like a horse race to show that. And some facilities do use the fun versions, but others shy away from it just because of the organizational culture. But certainly investigate which fits your organization individually. Engaging all staff that are necessary for this project from the beginning is very important. This could include pharmacy, lab, nursing, dietary or nutritional and food services, radiology, surgery, any of your specialty areas, the billing department, and any others that you might find are needed in this process. Respiratory therapy would be another place that you could see having the CPOE affect them when providers put orders in for nebulizers and things of that nature. It's important to include all that will be affected by the implementation, because many times others are not aware of the effects certain processes have on other departments. An example of this is in a hospital that I worked in, there was a change in the order process for bedside blood glucose testing. The ER staff wanted to be able to order the test and perform the test and result it in the emergency department to enable them to treat their patients quicker, instead of having to call somebody from the lab to come down and do the bedside blood glucose finger stick and then result it and enter it. What they failed to remember is there were some other issues and ramifications as a result of this process being changed. How it was going to be entered in the chart, how that documentation was then going to be resulted by the laboratory, how this would be billed, and a few other areas that just came into play after they had changed the process. So they did have to go back and rework out that process to make sure that it worked. Of course, patient care was the priority, but also making sure those workflows were conducive to all departments was important. Mapping out those workflows that you want to happen during this implementation process is very, very important. It's key to map out your current state or how things work now, and then mapping out your ideal state. So this is just an example of how an ideal state may happen. The provider enters the order via CPOE. The pharmacy receives that order immediately and checks for accuracy, and then makes it available in the Pyxis machine for automated dispensing. The MAR is populated electronically with the order and is available in Pyxis. The medication is then checked out from Pyxis by the nurse. The patient is given the medication after the 5 rights are checked, and then the nursing documentation is completed electronically of the medication that was administered. If you look at the current state and ideal state, it will help to design the workflows to make it as ideal as possible. Be sure to have practice or trial runs of the new workflows to ensure that they do work exactly as you planned. This workflow mapping and current state and ideal state is also part of the Toyota Lean process. So if you Google Toyota Lean, you will find a wealth of information on the internet related to that if you are curious about more ways to perform these workflows and ideal states. Also, it's very important for you to update your policies and procedures as you change those. Now moving on into training. It's very, very important to offer training at varied hours. A lot of times, especially in hospitals, you have staff that work different shifts, different hours, and having a variety of trainings available at various hours is very important. You can develop a training schedule for all shifts and then create a sign-up sheet for it and make it mandatory. It's important that all of your staff are trained with the same information from the beginning. Also, finding out from providers when training will work well for them, and it's always a good idea to feed the staff or bring them treats when they're providing the training. In my experience, providers often like to be trained one-on-one, but you can do some general training in the beginning. Typically before they round in the hospital, they like to come in and have breakfast and go through some of the training. And you have to make it brief. They're not going to stick around for a long time, so you might have to change your training into bite-sized pieces or specifically book one-on-one time with those providers so that they're able to receive the training they need. One sample of this is in the hospital that I worked in, we implemented a Pyxis machine, which is automated dispensing, and this was really the first adventure into any sort of electronic equipment or computer-based equipment that the nursing staff had ever really worked with, and they were quite nervous. And so as a way to kind of make it a positive experience, we kept chocolate at the Pyxis machine for the nurses to grab a piece of chocolate as they signed out a medication, and it really seems silly, but it actually was great. It worked well, and they enjoyed having that available to them as they went through the process. Having the staff sign off that they were trained appropriately. This is another method that we had used. There was some issues with staff being trained on new implementations, and then they would come back and say, well, I never got the training, or I didn't understand the training, and were not as engaged as they should have been. And so at the end of the training process, we would have the staff sign off that they received the training and that they understood the training, or else we had a place at the bottom that they could check and ask for some extra training and extra one-on-one help with learning the process better. And this helped in two ways, because one, it made the staff responsible for paying attention and understanding the system. And two, if they really didn't understand but they didn't want to ask questions in the group, or if they felt intimidated or they just weren't sure, they could just simply check that box and sign it, and then we would go back and have one-on-one time with them with training and implementation. So they always felt like they got that attention that they needed to understand the CPOE or whatever EHR product we were implementing at the time. So it did prove to be very, very helpful. Downtime procedures and policies in place. This is really important, and you have to train the staff on those procedures and then ensure that everything that they need is all together in one place. So using a big red notebook that has all of the downtime procedures and the paper-based orders in place, and making sure that they always know where that's at. And really, truly, you should not wait until the system goes down to try out this downtime procedure. have the equivalent of a mock fire drill, only with downtime procedures, and let them use that so that they feel comfortable and it's not during an urgent time where things may be crazy and they don't know what to do. So you can plan it at an ideal time and let them go through that fire drill process of downtime procedures and ensure that they're comfortable with it when you do actually need to use it. Another piece that's very, very important are these pick lists. Creating a customized pick list of favorite orders for providers, it helps them to be able to quickly use the system. And most providers are very, very interested in expediting any process that they need to do. So if you create their pick list of their favorites, it's sort of like creating your favorites in your internet browser. You can go immediately to the place that you know you want to be and pick what you want to order. And another tip that I usually tell all of my practices in my hospitals is to order them the same for every provider and for every order set that you create. So if pharmacy is at the top, it's at the top for everybody, and put it in the same order. So a provider knows I'm going to order my meds, then my labs, and my radiology, and then any ancillary orders, and that's what I do every time I go in to put my orders in. And also streamlining those processes between the hospital and the clinic. So if you have an EHR and use CPOE in both places, the way the order sets are set up are the same, because as everybody knows, if there's any differences and variations in processes, that's where errors can happen. So if we streamline it, that makes things much, much better. Another key piece to consider is access. So providing that appropriate access. And sometimes when you're first going through implementations, staff thinks that they will use a tablet all the time and they will love it. And then you buy a bunch of tablets and then they hate them and they go and they use the desktop PC. And then you have 5 people waiting to use the desktop PC because everybody likes that better. So my recommendation, if you're going for a new implementation, that you use a variety of different methods for them to use, whether it be a tablet or a computer on wheels or desktops, and you have a few of each, and then you find out which ones are really using, and then you supplement those and increase the number of those that are available. In my experience, most of the nursing staff and providers prefer the computer on wheels or the desktop PCs. And the reason being is they can sit down for a few minutes if you use the desktop PC. And when you're working a 12-hour shift and you get a few minutes to sit down and document, that's really a nice place to go. So just really individually look at your organization and what works for you. Sometimes when people are not used to technology, they can get extremely frustrated. So being that kind of person that's always there for them and being able to help them through processes is really important. I got a phone call once. I was the director of informatics for a critical access hospital, and I got a phone call one afternoon from a nurse, and then the floor was very, very busy, and she was trying to put some orders in, and she was like, oh, this mouse won't work. You got to come help me. I don't know what to do, and this mouse won't work, and this computer's making me crazy, and she was just obviously frazzled. So I went down there, and in her hurry, she had pulled on the mouse so hard that it came unplugged from the USB, and so it wasn't really an issue with the computer. It was just the mouse came unplugged. So I went there, and I crawled under the desk and plugged it back in, and she looked a little bit embarrassed at first, and then she was like, thank you. I know I'm overreacting. I've had a crazy day, and so thank you for coming right away and helping me. And you're going to run into those things. But that instant gratification and being there to support people, even if it's something as simple as plugging back in the mouse, is really, really important for them to feel that they have somebody supporting them, and they'll engage, and they'll move forward, and they'll learn the system a lot better if they know you're there to support them whenever they need you. Another piece that I'd like to cover is collection of this baseline data prior to implementation so that you have it as a reference. It's really about perception. So if you track the amount of time it takes for a paper-based order to be processed and actually given, and then you track it after implementation after a few months, and you look at the time difference, you'll be amazed at how different that is. And we've actually done studies with some of our hospitals and tracked that, and we're talking a difference of 15 minutes to over an hour from electronic versus paper for several different orders. And if you think about the workflows and the processes as you map them out, there's a lot of stopgaps in between a paper-based order. The provider might go get the chart, write the order, fold the order paper over and lay it on the desk and wait for the ward clerk to pick it up, or the unit secretary, and then she goes through and she puts in the order she can put in, and then she sends it via fax or messenger to the pharmacy, and then the pharmacy has to pick up that order off of the in-basket or the fax machine and go through and enter the orders and do all the double checks and get the medications in the system. And then if you don't have automated dispensing, then the pharmacy actually has to go and get the medication and prepare it for the patient and then send it to the floor. And then the nurse has to check the cubicle or the nurse server and get that medication out, and she has to check because she never knows when it's going to receive, so she has to be received, so she has to go back and forth, keep checking for the med, checking for the med, checking for the med. Then once she gets the medication, then she has to go in and check it, double check it with her order, which may have just gotten put back in the chart from the fax machine by the ward clerk, and so then she has to go find the chart. I mean, you see how this process goes with paper. The provider doesn't necessarily perceive how long it takes because they write the order and set the chart down and walk away. What happens after the fact and prior to the patient getting the medication is really what delays the care and what takes a long time. Now, with an ideal situation with CPOE, the provider puts the order in, it automatically goes to pharmacy, the pharmacist double checks it, it opens the availability up in Pyxis for the nurse to grab it, she gets the med, she gives it to the patient, and it speeds up the process tremendously, along with being safer because there's double checks when the provider enters the order, when the pharmacist looks at the order, and when the nurse looks at the order. So you're having at least 3 sets of eyes double-checking that order to make sure that things go the way they should be. So when you collect this baseline data, it allows you to evaluate if CPOE has had a positive, negative, or neutral consequence. It will also allow you to have an accurate depiction on how long it took to complete orders on paper versus CPOE. And initially, it can be perceived that it takes longer with CPOE, but it's temporary, and there's a learning curve, and you have to expect that. And I really recommend that you're forthright with your staff when you're going through the implementations, that yes, it will slow you down a little bit at first, but then after you get your groove and after you move through the process, it will get better. I think we've all gotten new cell phones, and when we change from one cell phone to the other, it takes us time to figure out where everything's at and how to use it. But after a month, we're pretty savvy and we're able to use it, and so there's changes that happen all the time. Order sets and best practices. So it's really important to consider tracking those uses of order sets and best practices, and also tracking verbal orders and telephone orders pre and post implementation. If you see an increase in use of the order sets and best practices and a decrease in phone and verbal orders, this can show how it's a positive result of the implementation of CPOE. Another tool that I recommend is using cheat sheets, and this is just an example of what you can enter on your cheat sheets. So the methods that I used personally with my staff was that I created a full Word document that had screenshots and walked the people through step by step how to do different tasks with CPOE. And then I created a concise version that was very small, and we made the sheets of paper that had this information on it. So this is like every arrow is a click. So you go to patient charts, and then you click on order entry, and then you click on the order entry tab, then meds, select meds, process, and sign. That's the step-by-step in the quick version that we would print on a small sheet of paper, and then all of the nursing staff had those little pocket or purse-sized photo albums, and they would print these off, and there was 4 per sheet, and we would cut them apart and print them off, and they would put them in that notebook that had the laminated, sheets that you would slide the pieces of paper into, and then they could carry it in their pocket or keep it in their locker and have that available, especially if there's like things that they didn't do very often and they couldn't quite remember. They could just go grab their notebook and take a look, and it would walk them through step by step. And they could also write notes of their own to help prompt their memory. So this is just something that we used and was really successful. And they can put anything. It doesn't have to be just CPOE information. They could put any information in that notebook to have for future reference. So before go live and even after, it's important to review those goals and timelines and make sure that everything has been addressed, to double check all your safety procedures. And I can't reiterate this enough, that the patient safety and care is ultimately the priority in any of these implementations. So you really need to do your due diligence and ensure that this patient is safe and taken well care of, regardless of the process. Sometimes staff gets a little too concerned with using the computer. When we implemented an electronic medical record in the emergency department, the staff got a little frazzled, and they're like, well, what do I do if I can't get to this, and what if my patient's coding and I don't know how to use this? And you have to tell them the patient is your priority. The computer comes second, so just take care of your patient, and then whatever you have to do after the fact is what needs to happen. Now, if the patient isn't in, a critical situation, then you follow the appropriate policies and procedures and processes, and you take your time and you do it the right way. But ultimately, the patient safety is the most important, and patient care. You need to expect that there's going to be some issues during the implementation and really plan accordingly. So in other words, have all hands on deck during the go live and those few weeks after when everybody's transitioning into this. And this includes all shifts. If you have night shift nurses that are new, it doesn't mean that they don't need somebody there to help them through it. So definitely having somebody on every single shift and having those super users available. And requesting feedback from staff and evaluating the end users for their proficiency and use of the CPOE system. Implementation. We are definitely creatures of habit. So I have a little test for you. I want you to take and fold your hands like this gentleman on the left, and you'll notice that one thumb is on top of the other. Now I'd like you to take your hands apart and put your other thumb on top and switch the way your hands are clasped together. And it feels odd, it feels strange, it's unusual for you. But if you open your hands and do it a few times with the new way, after each time, it starts to become more and more familiar, and it doesn't feel quite as awkward. Same thing applies. Cross your arms as if you're mad at somebody. You usually have one hand or the other on top. Now I want you to put the other hand on top. It feels awkward, it feels strange, but the more times you do it, take your arms apart and put them back together, it starts to feel familiar. So that's what I want you to think about when your employees are going through this process, and you can certainly steal this and share that with them as you go through this process. To share with them that it is a change, but it doesn't hurt anything, it's just different. So this leads us into change management, and this is a huge piece of implementation of any new module, including CPOE. Some people equate change to those 5 stages of grieving, process, and death, that denial, anger, bargaining, depression, and acceptance. And it's supposed to be a little bit humorous that, people go through the same process of going through changes as this denial. I don't want to do this. I can't do this. Why are you making me do this? Can we just wait and maybe do it another time? We don't have to do this, do we? We'll get better about making sure our paper orders are better. I guess I'm going to have to do this. And then accepting it and saying, no, this really isn't that bad. So recognizing just really how your organization goes through those changes. There's various processes that organizations go through, and it's very much based on your culture. So there's norm-based changes, which means that, you create this norm. This is what we do, and this is how we do it. So you have to do it because this is the way it is. There's incentive-based or milestone-based changes. So if you get to 80% of CPOE use, then we'll have a pizza party for you. Or there's option-based changes, which means this change takes place over time. So what that would be is, okay, for the first 6 months of implementation, you have a choice whether or not you use the system. You can use it for part of your orders or all of your orders. You need to get trained on it, but then after 6 months, you have to use it, and that would be the option-based change over time. Change is not easy for anybody, but there are certain providers that really are set in their ways, and I've had several experiences. When I worked in this critical access hospital, one of the providers said, if you make me use a computer, I'm going to quit my job and go hunt and live off the land with my dogs. And that was the very first time I met him, so it was interesting. Another provider, I went through the process of training him on the computer. He was a contract provider who came into the emergency department as a contractor, and he knew that they had an electronic medical record, and I came in at 5:30 in the morning on a Saturday morning to train him because he didn't want to come in prior to that shift that he was working to get trained. So I planned on spending the whole day with him, and we sat down at the computer, and I showed him, I'm like, this is, your home screen, and this is where you log on, and this is your tracking board, and he was standing over me with his arms crossed and this sour look on his face, and he kept kind of huffing and puffing and, shifting his feet, and, just obviously, body language was telling me he wasn't happy. And I said, you knew that we had an electronic medical record, didn't you? And he goes, well, yes, but I didn't know I was going to be playing secretary all day. And so those are things that you can potentially run into. But, after a while, I stuck with him. I encouraged him. I showed him things. And by the end of his shift, he was like, hey, if you put this order over in here and added that to that order set, then that would go over. And then, he was having like ideas and epiphanies and getting excited and showing, asking for, can you add this to my order set? Well, can I do it this way? So it's just that matter of warming them up to the change and supporting them and helping them through the process. And, when that day first started out, I thought, oh my goodness, this is going to be the longest day of my life. But then after he warmed up and he got used to it, it really was a positive experience and he did a great job. So those are just a few pieces. Within any hospital, the best way to achieve that behavioral norm-based strategy is to provide that continuous at-the-elbow support for those new users. And again, that's just from the story I just told you, being there right with him, and so he didn't have to have that level of frustration. He had somebody right there to help him if he had questions. That really, really improves the overall impression and acclimation to those changes. And so understanding that culture in your organization and making it the most effective way for you to implement the changes and have it be a positive culture is extremely important, so evaluating that as you go. And this is just another method of talking about the 5 stages of changes, okay? So there's this subconscious anticipation. You know it's coming, you just don't know when, but you know it's there. Then there's that resistance. I don't want to do this. Please don't make me do this. I don't want to do this. Then there's that loss of control because you know it's coming and it's happening and you're going through this implementation process. Then there's the shock of the new, that adaptation, that, getting into that cold water and getting to swim. And then again, there's that acceptance. And you start to swim to shore and you find out this really isn't too bad. Okay, moving on into EHR setup and configuration. So another piece that you have to consider during this implementation is that all of the alerts and the functionality, the quick picks, the user interfaces are all set up to provide the optimal use of your EHR. If there is extraneous clicks, they will, staff are click counters. In my experience, they'll tell you, it takes me 17 clicks to order Coumadin on this patient. They will take inventory of how many clicks it takes them to do that. So if there's any way to avoid having extraneous clicks for them to use, I recommend it. As long as it doesn't jeopardize patient safety, I think it's important for you to do that. And that can be customization for their personal uses. So customizing it to each user, especially the providers, if you have their favorites for orders, if they always order Tylenol 500 to 1,000 milligrams every 4 to 6 hours, whatever order they like to have for all of their patients, and they're creatures of habit again. So having those orders easily available for them to just click on and order for their patients is really, really helpful for them. It'll help them get engaged. And then that instant gratification. I think everybody's kind of a fan of instant gratification. So if a provider comes to you and say, I really want to have the ability to add a sleeping pill in whatever kind they want and whatever dose they want, anytime I write admission orders for my patients, because I do that for a lot of my patients. If you put that on their quick pick admission orders and they can click a button and order it, they will like that, and that instant gratification, say, oh yeah, I'll go get that entered in now, and you can take a look. Next time you order admission orders on your patient, it'll be there for you. I mean, that really helps with customer satisfaction. Again, I always reiterate this, though, and I know I've said this several times, but that patient safety and usability are key factors that you need to consider. And then creating those standards of care and using them, creating those standards of use and using them, and making sure that the staff are using them. Put them in your policies and procedures. Provide education consistently for them, and make sure that they're doing it the right way. Because, variations in processes cause errors, and that's where you have problems. So making sure that everybody does it the same way. Support and feedback are key features when you're implementing CPOE and using CPOE. In other words, you have to provide that real-time support and avoiding the delays in assisting the providers, as we just talked about. Getting their feedback and asking them what's working well, what's not working well. And you can provide multiple methods for them to provide that feedback. You can have a suggestion box, you can have a phone helpline, an email address, whatever method they prefer, but giving them multiple venues to be able to express what they need is very important. If you do that, then they can communicate their needs or frustrations, and it'll help you mitigate any issues before it becomes a long-term issue and causes more frustration. And again, following up with anybody who has brought up an issue or a concern, because if they don't feel like their voice is heard, they'll stop talking, and when they stop talking, that's when things go bad. So you need to make sure to follow up with things, even if they don't seem important. It was important enough for them to provide that information to you, so you really need to follow up with them. So this is actually one of my hospitals that I've worked with, and I went through the CPOE process. I worked with them through the REC, and a great group of people, lots of fun, really, really amazing people. And I went through this whole process with CPOE implementation with them, and one of the things that I had recommended is for their super users, making them easily recognizable so that when a doctor is down the hall and putting an order in and he looks down the hall and needs help, he can identify whoever it is that knows how to help him with one look down the hallway. So making them easily identifiable, this is what the shirts that they came up with, and they call themselves the DOT, Department of Technology, and on the back of their shirts it says, "Do not follow me into the build zone," because they were, building the CPOE templates and everything. So really cute, fun group of people. Anything that makes your super users easily identifiable during your implementations, and engaging them and recognizing them for what they've done, because it does take an extra effort for them to learn to be a super user, and really just showing them that you appreciate them is important as well. Another factor that's important to consider is not delaying that implementation, because if you delay the implementation, you decrease momentum, and staff just, you get ramped up to do something and then you don't do it. It just really squelches their passion to get through this and make sure it happens well. So be sure to stick to this as closely as possible to those timelines, and decrease the risk of losing end user dedication and enthusiasm. And also the delays increase the risk of staff forgetting the training that they've had and the education they've received. So, ideally within 2 weeks of training, they have implementation, but at a maximum, it should be a month, and at a month, you're really losing a lot of your information. So making sure that training happens just prior to implementation. I put this in here because I think this is important. If the nurses are happy, then the providers are happy, and this isn't always true, but your providers rely on the nurses, and the nurses will tell the providers if they're not happy. And so if you get the nurses happy, then they're engaged, then they like it, and then they're going to help those providers who may not be able to use it quite as well as others. They will be that super user for them. So really happy nurses do make happy providers. Another thing that's important is to take a look at and evaluate the initial request for changes in the system. Some of it may be a knee-jerk reaction. Some of it may just be acclimation to the change of processes. So again, going to the staff that put those requests in and talking it through with them and understanding what they want, but not necessarily changing everything all at once, because you need a little bit of time to get a status quo going. And if it's something significant and you really feel like it needs to be changed, obviously go ahead and change it. But if it's something that may or may not be a big deal and nobody else is really saying a lot about it, see how it shakes out, give it a little bit of time, make sure it's not that knee-jerk reaction, and then you can make those changes later if it's necessary still. Making it as simple and easy as possible. So you really want to avoid the alert fatigue without compromising any patient safety. The logins and passwords, I understand the frustration because I have a bajillion logins and passwords for different places. And so if you can really kind of pare that down as much as possible, single sign-on is ideal as long as it's safe and you have your data integrity and your privacy and security is all up to par. That single sign-on can really make a huge difference in end-user satisfaction. And tracking your progress. So creating those graphs and charts and showing staff how they're doing and providing that feedback. You can also consider rewards for attaining certain goals in your planning process, such as a pizza party or ice cream social. And those are things that can be done on any shift in a hospital. So I know I talk a lot about hospitals, but I think there's extra considerations when you're in a hospital. and there's extra considerations that you take into place with a clinic. So just taking a look at what works for all of the staff. And then, you can actually instill some competition in some of your providers by creating those forms. So, for example, one hospital I work with, for every time their providers meet for their med staff meeting, they print off a sheet that lists all the providers and then all of their percentages for CPOE orders, all in one sheet. Everybody can see what everybody else is doing. And this may not work in other organizations, but in this organization it works because their staff, their providers, are very competitive. So if Dr. Jones sees that Dr. Miller has 95% compliance with CPOE and he's only got 88, he is going to bust his hiney to make sure that he gets 97% to beat him. So, if it works in your organization, that is a technique you can use. Otherwise, I still recommend showing your providers how they're doing. So in other words, you can show their individual report, and then you can de-identify the rest of it and show an aggregate that you are meeting 88% of your orders via CPOE. The aggregate is 95%, and it still motivates them, but yet doesn't call out what they're doing for the rest of the, to the rest of the providers to see. Another important piece is really celebrating those successes. I really strongly believe in rewarding people and encouraging people and recognizing people for when they're doing a good job. So if you have some staff that are doing a tremendous job, celebrate it with them. Do the little things. It's important. People feel important when you tell them they're important and when you show them they're important, and celebrate the things that they do. So recognize your staff and providers on their successes. So optimization. I say the work of a genius is never done. Reporting and training. So you need to go ahead and run those reports and show the effects of CPOE. Positive or negative, it's very important to have that information available to you so you can assess how you're doing. And this process is never complete. There's going to be upgrades, there's going to be updates, there's going to be changes, there's going to be different order sets or best practices that change. So it's really never ever done. And continued evaluation and maintenance of this information is important. Another key piece is ensuring that there's frequent training and retraining that is offered to your staff. Just in case they get a little rusty on it or they don't work very often, they can come back and get some retraining or watch webinars or videos that have been recorded, or do some worksheets for them, or let them come in and use the test server to play around just to get more comfortable with it. So establishing those training methods and trainers for the new employees, it needs to be consistent. And we used to jokingly say we want our nurses to use their powers for good and not evil. And so what happened was the night nurses didn't want to use the barcode scanner on the arm bracelets when they were administering a medication in the middle of the night because it beeped and it would wake their patients up, and they didn't want to wake their patients up. So they went and printed off armbands, and then they would hang the armband in the cubicle and scan it, and then scan the med before they went in and hung the IV bag or whatever. And so we had to quickly let them know that that was not okay, and then work through the process of how do we fix this and make sure that this works so you can do it the appropriate and safe way. And so we were able to turn down the beep on the scanners, and so at night then it wouldn't wake the patients up. But, your staff are extremely intelligent. They wouldn't be doing what they're doing if they weren't intelligent. So being consistent and making sure that the trainers train staff the appropriate way to use the system. Planning for staff turnover. And, if you have that loss of information, if only one person really knows how to change order sets in the system, and then they quit and they leave, or they get fired, or, something happens, you have a full loss of that information, and you have to scramble to retrain somebody or find somebody who knows how to do it. And so I've seen that happen multiple times in organizations. So really important to have at least 2 or 3 people trained on how to use the system and how to make changes and how to train people and how to use a test server and so on and so forth. Another important piece is to develop that issue tracking log and use it. So again, when people come into that suggestion box and they come in and leave messages on the helpline or call you up or email, tracking those logs, tracking the follow-up, making sure it's all taken care of. You can even put it in a WIP document if you want to create an easy way to update those issues. Again, the most important thing is it's about the patient. Patient safety is a priority, and we all need to take a look at our patients and ensure that we are taking the best care of them. And so if we use the system well, it can make the workflows for provider order entry and administration safer. But we really just need to make sure that that happens, and that can include, going through some trial runs on the test server before we actually implement these changes or processes. But most importantly, it really is about the patient. Nothing substitutes that one-on-one direct interaction between providers and nurses. So I don't want people to pull away completely from that interaction, but I do think that EHRs and CPOE can really be a great tool to use and take good care of our patients. So in conclusion, planning for your implementation and planning well is imperative, and it gives you the solid foundation in order to move forward with the implementation of CPOE. During the implementation process, it's important to monitor and train and pay attention to detail and listen to your staff about how things are going, and also show your staff how they're doing. And then optimizing the use. Once you're implemented and you've gone through that initial transition period, really taking a look and making sure that you're monitoring and tracking and ensuring that things are going well and that you're using the system to the best of your ability, and that staff are trained appropriately, and any changes that are necessary are being done. But again, focusing on that patient safety and making sure that you're taking the best care of your patients as possible. So here's my contact information. Please feel free to give me a call or shoot me an email, and the Telligent website is listed there as well. Happy to answer any questions, and I hope you have a great day and learned a lot. Thank you so much.